All right, Natalie, like I said before, thanks so much for doing this. My first question that I have for you is, just tell the audience a little bit about yourself and how you got started in counseling.
Okay, hi. My name is Natalie Wisdom, and I'm a licensed clinical social worker. So I've been in the field for over 16 years. It's been so long, I think I've lost count. So
Mhm.
I originally started doing therapy in 2007 when I graduated from Springfield College with my MSW. So I worked in outpatient settings pretty much throughout my entire career. And now I am the owner of two private practice because I'm dually licensed in the state of New York and Connecticut. So I just kind of always really like to help and support people. And I think that was just kind of like my passion. So yeah, so that's kind of like what I've been doing.
Mm-hmm. And so what do you do in your current role? I understand you're the CEO of one of your private practices. Is that correct?
Yes, so I am the CEO and founder of two of my private practices. So I have a private practice in the state of New York called Pieces of Wisdom, and I have one in the state of Connecticut called Divine Resilience Psychotherapy. So because I'm dually licensed in both states, so the two practices pretty much function the same way. We are providing individual therapy, group therapy, family therapy. We do some couples therapy. We provide workshops, consultations. I also offer life coaching because I'm also a certified life coach and immigration evaluation. So we provide an array of services to individuals who are just really looking for support on their healing journey.
Mm-hmm. And I always ask therapists this, what sort of what sorts of modalities do you use in your work as a mental health professional?
Absolutely. So a lot of time we do a lot of talk therapy, which is pretty common. So narrative therapy. We do a lot of CBT, cognitive behavioral therapy, where we're really kind of working on changing or helping the clients to change their thought process. I'm also an EMDR practitioner, which is eye movement, desensitization, reprocessing therapy. So I recently got certified in that earlier this year. So that's really kind of working with clients who have complex trauma to be able to help them decrease the negative charge that they are feeling around these past traumatic events that they're having. We also use a lot of DBT, dialectic behavioral therapy, motivational interviewing. So those are some of the modalities of treatment. But I will say the biggest treatment modality that we use is really just building a therapeutic relationship with a client. I think that's really kind of the biggest and most important thing when you are doing therapy is being able to connect with the clients that you're working with. I think that really goes a long way, building that rapport, providing that safe and non-judgmental place for the clients.
Mm-hmm. Because because that was my next question. So how do you
Mhm.
build that rapport between the practitioner and the client? Because oftentimes, and I've experienced this too, in therapy and in conversations with other folks who have therapy, oftentimes they don't feel seen or heard by their therapist because they're looking for that right fit. So how important is that sort of to establish that relationship?
Oh, very important. So what we do offer is a consultation. So when clients are looking for services from us, we definitely offer a consultation. I do have a group practice, so I have different clinicians within my practice, and a lot of the clinicians have different areas of expertise. So normally when a client is kind of looking for services, we offer a free 15-minute consultation with one of the clinicians, depending on the client's needs. So sometimes if someone is dealing with maybe anxiety or depression or past trauma based on their needs, it's kind of really kind of matching them with the clinician that would be able to support them best and providing them a consultation just to kind of have that dialogue because you can kind of tell of just kind of a conversation vibing if it's going to feel comfortable and if it's going to be a good fit. So we initially like to start with that, being able to provide that consultation. And I think just being able to, we're very client centered. So being able to let the clients know that this is your space. This is a space place that you can show up, you can be yourself, you can share what it is that you feel comfortable right now. So really kind of helping to build that rapport and meeting the clients where they are, like really not pushing them. Because sometimes clients aren't ready to talk and share certain things. So I think going at their pace and really kind of giving them the space to be able to, share when they feel the need and they feel that it's right for them. But until then, we show up in that space. We're here, we're listening, we're doing active listening, and we're teaching whatever other coping skills that's needed in those moments.
Mm-hmm. And I forgot to ask this, but like I know you mentioned like that you guys do a lot of use a lot of modalities, but what's like kind of, and I also as therapist this, what's your favorite sort of modality to use?
Mhm.
And like what's sort of the most challenging, I guess I would say.
So I said, I guess, everyone kind of defaults to like CBT, but I'm actually, since I'm trained in EMDR, I think that's been my favorite right now. Because it's when the clients come in, they're really kind of dealing with a lot of like trauma, flashbacks. They're just kind of struggling with the traumas that they are experiencing and going through that, those 8 phases of EMDR. We're able to kind of go through the process to really kind of desensitize that trauma and really kind of work on instilling more positive cognition. And you can kind of see the charge just kind of like decrease. So, with that clients and they report feeling better after going through that. So I think versus, if you're working on doing some CBT or motivational interviewing, I think with the EMDR, there's I would say a more rapid result versus, a client doesn't have to be in treatment for 6 months for them to see a decrease in those charge or those negative feelings that they have been feeling around the trauma. So I think it's definitely a lot quicker to be able to kind of support them even more and giving them the relief that they need. So right now, I'm really liking the EMDR a lot. But I do love CBT. I always tell my clients, you change your thoughts, you change your life, right? So it's really kind of giving them a different perspective of looking at things. I'm really kind of unlearning and, unhealthy patterns and relearning kind of new patterns and reframing, their thought process. Again, kind of, releasing kind of like that negative thoughts and really kind of focusing on learning more positive thoughts. I also like motivational interviewing as well, because that really kind of allows the client to be the driver, of their own goals and what they really kind of want to work on. So it's kind of like you're really practicing a lot of active listening, a lot of reflection, and you're not pushing a client to do what you feel is really necessary, but you're really kind of allowing the client that autonomy to make those decisions and see the goals that they need to really kind of make or the goals that they need to kind of accomplish and how and giving them different perspective on, how to accomplish that. So
Mm-hmm. And my next question is, I always ask my guests this, what's sort of what have you learned as a CEO of two private practice? What have you learned in sort of really working with clients and also like how because you your private practice, you guys have like a staff of people in the mental health profession. So like what have you sort of seen not just in those two fronts, both in working with clients but also seeing, like uh s- mental health professionals in your sort of private practices.
yeah, so being an entrepreneur is not an easy thing. Everyone's like, "Oh, I want to be an entrepreneur," but I think for me, my biggest thing also with kind of being an entrepreneur and having two private practice, I not just run the private practice, but I actually work in the private practice. So I have clients myself that I see. So I think my biggest struggle right now is to kind of step away from maybe a lot of the admin tasks that I have been kind of doing and really allowing. I do have a part-time admin staff too, but really kind of switching some of my responsibilities that I've been taking on because I can't do everything, right? I can't be the marketer, I can't be the admin, the CEO, and the founder on top of being the clinician. So I think relinquishing some of my roles and responsibility to others and really kind of have, be able to have that support. I think, one of the great things, yes, I have about 13 clinicians in both between the two practices, which has been great. And, I love to see kind of like the clinician growth over their experience with me. So they'll come in and they might be a little green. That's kind of what we say when we new social workers like come into the field. And sometimes they're like really nervous to work with clients or like, oh, I'm not like, I don't know how to support or help those clients. And to see them kind of take on the different challenges and really kind of push themselves outside of their comfort zone to, get better clinically, and they're taking trainings to improve their clinical skills, and they also start to see the progress with the clients. I think that has been really great. So I definitely kind of like enjoy the growth that I do see with the clinicians and being able to pour into them as well.
Mm-hmm. And and my next question is what's on your bucket list? What do you still hope to do or to learn in your sort of in 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 your role, I guess? What are kind of like your next steps that you want to do in the future? Do you want to focus on something, like CEO type positions for mental health practice, or do you want to like step back and kind of go in a different direction, do more private practice? What's in it for you?
So, sustainability within my private practice is kind of like the biggest. I do want to grow a little bit more. So, my goal is to at least have about 20 clinicians, and maybe we're servicing anywhere between 300 clients. I think that would be a comfortable space for me. But I think as I grow, how do I honestly can kind of step out of being the clinician and just really kind of running the business? And also maybe bringing on people that can help me to run the business. So, the thing about entrepreneurship or even kind of going to school for social work, nobody teaches you how to run a business. So a lot of these things you have to kind of like learn and, figure out on your own. So that's really kind of been big task, and I think I've been pretty good with actually learning about how to run a business. But eventually I do want to scale back from probably from actually seeing as many clients as I am. I do love the work that I do, but I think it probably would be nice in the future to just run the practice versus actually fully working, and seeing clients and being the marketer and doing, all these admin stuff. So that would be it for me.
Mm-hmm. Because it's a lot on your plate having to manage everything.
Absolutely. It sure is.
Yeah, and my next question is, I always ask I always remember having this conversation with a psychotherapist the other day, and she talked about how she had some sort of a model or a mentor
Mhm.
that inspired her to
Mhm.
get into psychotherapy. So what I'm wondering for you is, who was that sort of model, that sort of mentor that you looked to, and where you sort of said, I want to do this.
Yeah. So I was talked about it. It was I was in high school, and we had career day, and one of my friends mom actually came and she spoke, and she was talking about her role and what she does as a social worker. And I think at that point I was like, that's what I want to do. Like, I really want to help and support people. And that's kind of, so I've had that since that interaction or moments, actually listening to that parent talk to us about what they do and how satisfying it was to really kind of support people in this space. And I was like, I definitely could see myself doing that. And I think I'd be actually good at it. And I think I'll be able to kind of touch and support a lot of people.
Lastly, what kind of advice would you give to those, entering the mental health field, or who want to be like what you just did,
Mhm,
and a CEO of two private practices,
mhm.
and take on that big of a role. So what advice would you give on those fronts?
Self-care. That's my big advice. Because it can be a lot, right? So making sure that you're taking care of yourself in the process. I think constantly educating yourself around the different modalities of treatments. I think really tapping in and getting a mentor that can really help to support you in this journey. But it's very much doable. And I think just really being able to find that balance and know when to ask for help is going to be something, that those are like my really big advice.
Mm-hmm. All righty.